everybody, and welcome to the Mental Health Awareness Show with your doctor, Dr. Chirisa, your psychiatrist. Today, I'm going to be talking to you about PTSD. I've seen on social media this viral craze where people are sort of like doing 25 press-ups and are being nominated. Nobody has nominated me. I thought somebody was going to nominate me. But thank you guys, because I don't think I can do 25 push-ups at the moment. So I decided to increase the awareness of post-traumatic stress disorder by doing this show today. Now, very interestingly, I have had a personal encounter with post-traumatic stress disorder. One of my elder brothers, he went to our liberation war. And I still remember when I was a child, he would have this vivid recollection of what happened during the war. And we didn't know what was happening. And as a family, and with a strong traditional background, we thought there were some spiritual things that needed to be done. And that's exactly what the family did, but it never helped him. It's only now, doing hindsight, we now realize that my brother actually suffered from PTSD. And all the complications that he then had were as a result of untreated PTSD. And I've also seen quite a number of patients. I'll just give you a few examples without mentioning any names. I've seen a child who was involved in a road traffic accident. In that road traffic accident, the mother lost her life. The father got injured, and nothing happened to the child, but he witnessed all this. And every time he would hear a squeaking or a car, a squeaking of the tires, it would immediately, the child would go into frightened mode. The other one that I've seen and treated is an adult female who was violently gang raped or sexually abused. And every time he would see maybe a group of people just approaching or just walking in a group, that would actually trigger, those memories. And the other thing that I've seen, the last person that I saw this year was a middle-aged man who was robbed at gunpoint of his car, phone, and everything, and thrown into the bush. And every time now he just hears a loud sound, boom, 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 it triggers. So PTSD is something that is so real, and we need to be aware of it. So what is PTSD? Post-traumatic stress disorder, ladies and gentlemen, is a mental disorder, a condition that is triggered by a terrifying event, either you have experienced it or you have witnessed it. So you can either have gone through it or have actually witnessed it. And so most people actually go through these traumatic events. And they've got, what we call adjustment disorder in the first maybe 4 weeks or so, but they usually go back to normal. But a small percentage, maybe about 5% of people that experience these extreme conditions would then have post-traumatic stress disorder. And these symptoms can get worse. They can last years, months to years. It can interfere with your day-to-day function. So how do you recognize that you've got symptoms of post-traumatic stress disorder? They are generally grouped into four types of symptoms. Number one, you've got what we call intrusive memories. I'll go that into detail in a while. Then you've got avoidance. Then you've got negative changes in thinking and mood, and changes in physical and emotional reaction. And these symptoms will vary from person to person. Not everyone will have the whole four. Somebody can have number 1 and number 3. Somebody can have number 2 and number 4. Somebody will have the whole array. But once they are there, they are there. So when we're talking about intrusive memories, what we are saying is that these are recurrent, unwanted, distressing memories of the traumatic event that come into your head. We call that reliving or flashbacks. So the flashbacks are so real and so vivid that the person will have an experience as if that thing is happening over and over again. And you can imagine, this is a near death or a death in life matter. So it really causes a lot of an overdrive in stress, and causes severe emotional distress and physical reaction to anything that will cause that. Number two, we've got avoidance. What they will try to do is that people with PTSD will notice things that actually trigger their own symptoms. So they'll try to avoid. For example, if somebody, they'll start avoiding cars. Like, for example, the lady who was involved in an accident, they didn't want to get into an accident, into a car or anything. They would rather just stay at home. But they needed to go to work. They needed to go and do shopping. And it's not possible for you not to travel. Well, now it is, but before the coronavirus, you needed to travel to do something, So it's avoiding things that trigger the memories or that trigger the events from happening, or avoiding places, avoiding activities, avoiding people, avoiding traumatic events. I remember at one time I saw this refugee. He was from DRC. And he had post-traumatic stress disorder. And every time he would see a soldier wearing the camouflage, he would immediately freeze because of what happened, in their village during the war. Negative thinking, what is that? These are negative thoughts towards self. A lot of people will have a negative thoughts towards themselves, towards other people, towards the world, hopelessness. They'll have memory difficulties. They've got difficulties in maintaining close relationships. They feel detached from families and friends. They lose interest in other things, and they really become emotionally numb. So this is really a stressful condition, and it needs and warrants professional help. And now the last one is changes in physical and emotional reactions. These are what are sometimes called arousal symptoms, where somebody can be startled, or somebody can be frightened, hyper frightened. Somebody can just be on guard, and I'm sure you've seen people who are always walking with knives and as if they are in a war zone, ready to fight, with a lot of anger, angry with outbursts and things like that, overwhelmed with guilt and shame. All this is as a result of those things. But in children, especially under the age of 6, one of the things that we see is that they enact in their play, they actually enact what would have happened. So they start to play or role play what would have happened and what they would have seen. Or sometimes they can have nightmares or frightening dreams, and they'll wake up in the middle of the night. So what are common events that lead to post-traumatic stress disorder? Obviously, combat experience, especially with the soldiers, is very high. Anybody with combat exposure, the probability of PTSD is very high. Early child physical and sexual abuse, that's also a common leading cause of post-traumatic stress disorder. Physical outside, violent physical outside, being robbed in the middle of the night, and and all those kind of things. Being threatened with a weapon, with a gun, with an axe, with a knife, or whatever the case might be. An accident, a road traffic accident, a bicycle accident, all those kind of things. One of the things that we have actually seen is that being admitted in ICU is actually a risk for post-traumatic stress disorder. On Sunday, I was speaking to another group, Zim Hearts. Thanks Farai for inviting me to that platform. And I was speaking to these guys. These guys have had heart surgeries. So it's a group of about 100. That's just a support group. And I was just talking to them. And one of the things that came was this. And that just being in an environment where you've got all these lights beeping, and you are there, you don't even know what's happening, you don't even know what it means. And when you are out of the ICU, those memories are so vivid and they'll keep you up in the morning. So being in ICU or being admitted in ICU can actually cause post-traumatic stress disorder. And the other thing that we are now seeing now is actually the level of violent movies and violent video games. It's actually causing a lot of PTSD, especially in kids and even in adults. Because some of the movies, they are so vivid, I don't want to mention any names, but there are some that are so vivid and, they are really violent. So if it's not treated, it will lead to common things that it will lead to. It will lead to drug and alcohol abuse, and this is so because they'll be experiencing this distress, they'll be experiencing these symptoms, and what the patients, what they want to do, or the clients, what they want to do is they want to self-medicate, they want to quieten that frighten, they want to alter their mood, so they're going to use mood altering drugs or psychoactive drugs, and then they go into other problems. So usually they go into alcohol and drug, and they can actually have depression. As you can see from some of the symptoms, especially the mood symptoms, they are almost similar to having depression. They can even have suicide because of the hopelessness. They can have episodes of aggressiveness, violence, eating disorders. It then depends. And generally, the quality of life and the potential of that person's life is totally altered, and the help is what is needed. And right here in Zimbabwe, there are places that you can go. You can either go to Highlands Halfway House or Borodo Halfway House, and soon you can go to Mandara Manor. But how do you prevent post-traumatic stress disorder when something stressful has happened? And this is what I usually tell people. Prevention is very key. After surviving a traumatic event, a lot of people will just say, thank God, thank God. Yes, true, we must thank God. But that person who has survived a traumatic event needs to go for therapy. And I'm speaking to our people. Let's not just say people, Vaka Simba. No, let's help people. There is nobody who is strong enough, because these things will then affect them when everybody has gone back to their families and they are in their own, and they've got nobody to talk to. And I also want to say to people that have gone through trauma, do not appear strong. If you are having these feelings, tell people, say you're having anxiety, you're not sleeping, you're having flashbacks, so that you can get help. There's nothing wrong with, it's an illness, it's a disease, and it can be treated. And that's why we are bringing this, so that more people can come out and actually get treatment. So, yes, after a traumatic event, yes, you're going to have fear, you're going to have anger, self-blame, guilt, and all those kind of things. They are common reactions after an event like that. However, it is very important to have supportive therapy, and that's what I usually want to say. Supportive therapy to anybody who has gone through an event, and that reduces the amount of people that would then develop PTSD. And obviously there will be always those who then develop, and those ones that do develop would then need proper treatment, and this thing is treatable. And right here in Zimbabwe, we've got the capacity, the knowledge, and the know-how and the experience to treat these things. So, if you are suffering from PTSD, share this video, like it, make it go viral. Remember, it's helping somebody have a better life. I'm out. This is Joe, Dr. SM Chirisa. See you next month.